Access to healthcare is a fundamental right for all citizens. But how safe are the hospitals themselves in the face of escalating environmental damage from climate change? A new assessment report shows that a number of hospitals and healthcare facilities in Thailand are vulnerable to the effects of climate change. The study aims to find ways for policymakers to improve and ensure better access to healthcare, which is also climate resilient.
The important is that nowadays climate change affects people's lives every single day, most importantly to the vulnerable groups of Thai population, especially those who live in the rural area with limited access to the healthcare that they're actually entitled to as a Thai population. So this study is to identify the gaps and the challenges, also to provide recommendations how to address these gaps and how to ensure that everybody have access to good healthcare equally.
Climate consideration is very critical in every policy making. I think education and awareness raising among the decision makers as well as concerned stakeholders are really critical in order to foster multi-sectoral collaboration in order to achieve climate resilience among the healthcare facilities and healthcare systems.
The assessment report surveyed Rayong Hospital, Sansai Hospital in Chiang Mai, Suthep Community Health Center, also in Chiang Mai, and the Bung Yi Tho Medical and Rehabilitation Center in Pathum Thani. Tat Chalerm Suthipong Pracha, who led the study, found that the 4 hospitals are prone to climate vulnerabilities such as flash flooding, air pollution, and water scarcity. This will disrupt access to healthcare, especially for vulnerable people. However, he believes that climate change is posing threats to all healthcare facilities in Thailand.
For Thailand, the whole country is in danger. It depends on what kind of climate change effect we're talking about. If you're talking about air pollution, that's like the entire country. So now we are facing a situation in which we have so limited resources, but a lot of things to do. So in order to prioritize air pollution, we have to really sit down and talk how to proceed because the entire country is affected. In terms of rising sea level, the coastal areas, of course, which I don't think at this point Thailand has a clear plan on dealing with that. In terms of flood, it's a perennial problem. Everywhere, every region, especially in the Isan region, especially in the Bangkok and the vicinity.
As improving climate-resilient healthcare requires a collaborative approach, a list of policy recommendations for national-level agencies have also been proposed. These include a clear government policy allocating specific funds for climate mitigation and adaptation in the public health sector and facilitating collaboration between health-related and environmental agencies. Tat Chalerm believes that such issues remain the biggest challenges to improving climate-resilient healthcare.
Lack of coordination, national budget allocation process that doesn't make sense, and the absence of earmarked funding for climate change disasters. These 3 have to be resolved. Otherwise, we will just dance around the bush. And there will be no sustainable solution to the climate-induced disasters or any undesirable events that might happen in the near future.
Meanwhile, the Public Health Ministry's Department of Health revealed its roadmap for adapting to climate change. Their strategies include multi-sectoral collaboration and improving the overall healthcare system to cope with climate change. Another strategy is to improve sustainability, including waste and energy management in hospitals, which will be expanded to sub-district healthcare facilities in Thailand later on. Nad Bunag reporting for Thai PBS World.